Remember, your diverse background isn't a disadvantage, it's a toolkit for creating comprehensive public health solutions. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in public health and healthcare, I understand the unique challenges and opportunities that come along with bridging multiple disciplines. In today's episode, we are going to take the discussion from the previous episode about bridging disciplines and a little bit further to discuss moving from vision to action. There are 4 things that I'd like you to consider. The first is the importance of developing a cross-disciplinary framework. Understanding different disciplines or different disciplinary perspectives, common challenges or common integration challenges, creating synthesis from diverse knowledge and building credibility across fields. Having a diverse background is like having multiple lenses to view public health challenges. Whether you come from data science, social work, environmental studies, or another field, each perspective adds depth to how you understand community health. The key is recognizing how your various skills complement public health principles. For instance, if you have a background in education, you might see unique ways to improve health literacy programs. Or if you're coming from data analytics, you could strengthen epidemiologic research methods. Next is the importance of developing implementation strategies. So, project planning across disciplines, team building and collaboration, communication across different fields, managing diverse stakeholders. When it comes to putting your mixed expertise to work in public health, start by identifying projects where your unique combination of skills fills a gap. Maybe your background in environmental science helps you design better air quality monitoring programs for asthma prevention, or your expertise in community organizing strengthens vaccination outreach efforts. Focus on building teams that appreciate multidisciplinary approaches, and it can help you translate your diverse knowledge into practical public health solutions. We're not trying to reinvent the wheel. We're trying to really look for those opportunities for it to flow better. So, overcoming barriers would be the next thing I'd like to highlight here, because you're dealing with resistance, managing competing priorities sometimes, building consensus, and measuring success. So you'll likely face some skepticism. People often prefer specialists to generalists. The trick is demonstrating how your varied background makes you more effective at solving complex public health challenges. When dealing with competing priorities, use your cross-disciplinary experience to find creative compromises. For example, your business background might help you balance public health goals with resource constraints, while your community work ensures solutions remain people-centered. Let me give you a bit of a case study. Learn from others who successfully bridge disciplines in public health. Maybe you can look for those examples, those case studies, and maybe you know of people already. For instance, look at how environmental health specialists have integrated climate science into public health planning, or how behavioral economists have improved health intervention designs. Pay attention to what worked, what has already worked, like building strong relationships across departments, and what didn't work, like trying to force traditional public health approaches to fit others' fields and frameworks. Remember, your diverse background isn't a disadvantage, it's a toolkit for creating comprehensive public health solutions. Here's some actionable takeaways for you. Integration planning template. Maybe you can create that. Stakeholder mapping tool or a communication framework, and a progress tracking system. These would be really important for our next steps on the journey. Are you ready to put your multidisciplinary background to work? Start by creating a simple integration plan. That maps how your different skills connect to public health priorities. Whether it's combining your data analytics expertise with epidemiology, for example, or your community organizing skills and experience with health education. Develop a stakeholder map that identifies key players in public health who might benefit from your unique perspective, and create a communication framework that helps you explain complex ideas across different fields. We kind of talked about this in the last episode. Track your progress, not just in traditional public health metrics, but also in how well you're bridging gaps between disciplines. For example, if you're bridging environmental science into public health, measure both health outcomes and environmental impacts. These practical tools help your diverse background from an interesting talking point into a powerful force for improving community health. Bridging different disciplines with public health at the core isn't just about combining knowledge, it's about creating better solutions for community health, the challenges that communities are facing. Your diverse background is a unique advantage, giving you insights and approaches that others might miss. Whether you're bridging data science to epidemiology, environmental expertise to community health, or another combination of skills, the key is starting small, showing value, and building trust across fields. Remember, some of the most innovative solutions in public health have come from people who dare to think across disciplinary boundaries. By thoughtfully connecting your various areas of expertise with public health, especially the public health priorities, you can help create more comprehensive, effective approaches to improving community well-being. As we wrap up this episode, I'd like to remind you that I have 2 ways to support you on your public health entrepreneurial journey. If you are looking for personalized guidance, let's work together one-on-one, as I have the opportunity to do this at the time of this recording being released and for a little while into the future after that. Consider that option. As someone who understands the unique challenges of being an interdisciplinary leader, I can help you turn your innovative ideas into reality. Or if you are ready to join a community of high-functioning leaders like yourself, consider applying for our premium mastermind group program. You'll connect with other professionals who, like you, are bridging multiple disciplines and creating meaningful change in public health. Visit publichealthentrepreneurs.com to learn more. If you're interested in the option of one-on-one work, you'll need to send us a message through the Contact Us page, because we don't offer that directly as a program on our website, but you can certainly find a full page of details about the mastermind program there. All right, everyone. Until next time, have a fantastic rest of your day.